is the primary cause of glaucoma? Options are A. Increased intraocular pressure, B. Damage to the retina, C. Clouding of the lens, D. Loss of blood supply to the eye. The right answer is A. Increased intraocular pressure. Glaucoma is a group of eye condition that damage the optic nerve, which is often due to high intraocular pressure. What is the function of the optic nerve? Options are A. Refract light, B. Produce aqueous humor, C. Transmit visual signals to the brain, D. Adjust pupil size. The answer is C. Transmit visual signals to the brain. What is the sclera's primary role? A. Refract light, B. Nourish the retina, C. Provide structural support to the eye, D. Adjust the size of the pupil. The right answer is C. Provide structural support to the eye. Sclera is the white, tough outer layer of the eye that protects and shape it. Which of the following diagnostic tool is used to measure intraocular pressure? Options are A. Tonometry, B. Ophthalmoscopy, C. Retinoscopy, D. Visual field testing. The correct answer is A. Tonometry. Tonometry measures intraocular pressure, which usually aid in glaucoma diagnosis. The normal value of intraocular pressure or IOP is 10 to 21 millimeters of mercury. Let's explore the other options. What is ophthalmoscopy? Ophthalmoscopy is a visual examination of the interior part of the eye. The option C, retinoscopy, is an eye exam technique. It measures the refractive errors of the eye. And the last option, visual field testing, it is nothing but it measures the extent of your peripheral vision. Part of the eye is responsible for refracting light onto the retina. A. Iris, B. Lens, C. Cornea, D. Vitreous humor. The right answer is C. Cornea. Cornea is a transparent front part of the eye that refracts light. The cornea lacks blood vessels and bends or refracts light rays as they enter the eye. What is the function of the retina? A. Control the amount of light entering the eye. Focus images on the lens. C. Detect light and convert it into neural signals. D. Maintain intraocular pressure. The right answer is C. Detect light and convert it into neural signals. Retina is a light sensitive layer at the back of the eye that converts light into electrical signals. The retina contains photoreceptor cells, which is known as rods and cones. The photoreceptors convert light into electrical impulses. What structure provides the eye with color? A. Pupil, B. Iris, C. Retina, D. Sclera. The right answer is B, iris. The iris contains pigmentation that determines eye color and it controls the size of the pupil. Which part of the eye connects to the brain via the optic nerve? A. Retina, B. Lens, C. Ciliary body, D. Choroid. The right option is A. Retina. The retina sends visual information to the brain, to be exactly to the occipital lobe through the optic nerve. What is the transparent structure in the eye that changes shape to focus light? Options are A. Lens, B. Cornea, C. Retina, D. Iris. The answer is A. Lens. The lens adjusts its shape to focus light for clear vision at various distances. What is the primary symptom of macular degeneration? The options are A. Loss of peripheral vision, B. Loss of central vision, C. Eye pain, D. Blurred vision in low light. The right answer is B. Loss of central vision. Macular degeneration affects the macula. The macula is a small area in the retina that is responsible for central vision, which is nothing but allowing you to see the fine details clearly. So, if the macula is getting affected, this is the change that you can see. The first picture is a normal vision. So, if a person is getting affected, the macula, he loses the central vision. And macular degeneration is the #1 cause of vision loss in people, especially over the age of 60. To talk about the risk factors, smoking is the #1 risk factor, and there are other risk factors too: hypertension, family history, diet lacking carotene and vitamin A. Where is aqueous humor found? A. Between the lens and retina. B. In the anterior and posterior chambers. C. In the vitreous body. D. Around the sclera. The right answer is B. In the anterior and posterior chamber. The eyeball is divided into 3 cavities or chambers: the anterior chamber and posterior chamber, as you can see in the picture, where the anterior chamber is between the cornea and iris. Posterior chamber is between the iris and lens. And these two anterior and posterior chambers are filled with thin watery liquid, which is called the aqueous humor. Which area of the retina provides the sharpest vision? Options are A. Optic disc, B. Fovea, C. Macula, D. Peripheral retina. The answer is B. Fovea. The fovea located in the center of the macula. Macula lutea, as you all know, which is a small yellowish area in the center of retina right behind the lens. And this fovea contains the highest concentration of cones for detailed vision. What part of the eye produces aqueous humor? Ciliary body, iris, C. Choroid, D. Lens. The right answer is A. Ciliary body. The ciliary body produces aqueous humor which nourishes the eye and maintains the pressure inside the eye. Which of the following is a sign of strabismus in children? Options are A. Redness and tearing, B. Misaligned eyes that do not focus together, C. Progressive loss of central vision, D. Frequent eye rubbing. The right answer is B. Misaligned eyes that do not focus together. Strabismus occurs when the eyes are not properly aligned, which usually often resulting in double vision, which is also known as diplopia. Double vision is a condition of seeing two images of a single object, and the strabismus can also end up in amblyopia if untreated. Amblyopia is also known as lazy eye, which is a common eye condition that occurs when the brain doesn't fully process the visual input from the eye. Why are miotic medications like pilocarpine used in glaucoma? Options are A. Increase pupil size, B. Constrict the pupil to improve aqueous humor drainage, C. Decrease blood flow to the retina, D. Increase aqueous humor production. The right answer is option B. Constrict the pupil to improve aqueous humor drainage. Miotic drugs, which enhance outflow by constricting the pupil, and it tend to open the drainage angle. Miotics and mydriatics are drugs that affects the pupil of the eye. Miotic, it cause the pupil to constrict. Some examples of miotics include pilocarpine, acetylcholine, and carbachol, whereas mydriatics cause the pupil to dilate. Some examples of mediatric include phenylalanine and atropine. Now, how do you remember those two categories? If you know miotic, it's a little word. So it will cause little pupil. It's nothing but it will constrict the pupil. Whereas the mediatric, it's a bigger word. So it will make the pupil big. It is nothing but the pupil will dilate. Which symptom is most commonly associated with cataract? Options are A. Halos around the lights, B. Loss of peripheral vision, C. Blurred or cloudy vision, D. Eye pain. The right answer is C. Blurred or cloudy vision. Cataracts primarily cause progressive blurring of vision. What type of vision change occurs with cataract? Options are A. Tunnel vision, B. Central scotomas, C. Progressive blurring of vision, D. Sudden loss of vision. Right answer is C. Progressive blurring of vision. Cataract cause a gradual decline in vision as the lens become increasingly opaque. What type of vision do roads primarily provide? A. Color vision, B. Daylight vision, C. Night vision, D. Sharp central vision. Answer is night vision. Roads are sensitive to light and dark, and which are responsible for vision at lower light level, which is usually the night vision. Whereas cones, they are sensitive to color and they are responsible for vision at higher light level, that is usually the daylight vision. What causes diabetic retinopathy? Options are A. High intraocular pressure, B. Chronic hyperglycemia damaging retinal blood vessels, C. Retinal detachment due to diabetes, D. Blockage of aqueous humor drainage. Answer is B. Chronic hyperglycemia damaging retinal blood vessels. Prolonged high blood glucose level lead to vascular damage, which can cause diabetic retinopathy. Which structure focuses light onto the retina? Options are A. Lens, B. Cornea, C. Pupil, D. Optic nerve. The right answer is lens. The retina contains which type of photoreceptor cells? Options are A. Rods and cones, B. Cones and bipolar cells, C. Rods and ganglion cells, D. Cones and ganglion cells. The answer is A. Rods and cones. These are two type of photoreceptors where the rod cells are sensitive to light and are responsible for vision at low light levels, whereas cones are sensitive to color and responsible for vision at higher light levels. Which layer of the eye absorbs stray light? Options are A. Retina, B. Choroid, C. Cornea, D. Iris. The right answer is B. Choroid. The choroid is rich in melanin, which is a thin layer of blood vessels that nourishes the retina, which actually absorb the scattered light and prevent the scattering and maintain clear vision. What is the function of the lacrimal gland? To produce tears, B. To focus light, C. To regulate intraocular pressure, D. To transmit visual signals. Answer option A. To produce tears. The lacrimal glands are located in the upper part of the eye socket and produce tears to keep the eye moist. The optic nerve exits the eye at which point? Options are A. Fovea centralis, B. Macula lutea, C. Optic disc, D. Choroid. The answer is optic disc. In other words, the optic disc represents the beginning of the optic nerve. What is the role of the choroid? A. Protect the eye, B. Nourish the retina, C. Focus light, D. Regulate intraocular pressure. The answer is B. Nourish the retina. The choroid is a layer of tissue in the eye that supplies oxygen and nutrients to the retina. What is the name of the condition where the lens becomes cloudy? A. Glaucoma. B. Cataract. C. Macular degeneration. D. Retinopathy. The answer is B. Cataract. What maintains the intraocular pressure IOP in the anterior chamber? Option A. Vitreous humor. Option B. Aqueous humor. Option C. Tears. Option D. Lacrimal fluid. Answer option B. Aqueous humor. Which part of the eye contains photoreceptors? Options are A. Retina. B. Iris. C. Lens. D. Sclera. Answer is retina. The photoreceptors are rods and cones. If you find the video useful, please like, share with your nursing friends, and don't hesitate to subscribe the channel Nursing Exam Insights.